No doubt images of hospital wards during the height of the pandemic have a chilling effect. No one wants a repeat of these scenes, but right now we are hurtling towards something that may look very similar. It's why the country's top two scientists held an unprecedented address to tell us in no uncertain terms where we stand.
If we don't do enough, the virus will take off. And at the moment, that is the path that we are clearly on. And if we do not change course, then we're going to find ourselves in a very difficult problem.
This is the stark warning they gave. The graph shows if the virus continues to double every 7 days, we could see 50,000 cases a day by mid-October and 200 deaths a day a month later. That's because cases have risen dramatically in all age groups, as every line shows. And hospitalisations have also rapidly increased since the beginning of September.
The challenge, therefore, is to make sure that we do not enter into this exponential growth and end up with the problems that you would predict as a result of that. That requires speed, it requires action, and it requires enough in order to be able to bring that down.
Later, the UK's chief medical officers recommended the COVID-19 alert level should move from 3 to 4, meaning the virus is now rising exponentially. Addressing MPs, the Health Secretary confirmed those on low income self-isolating would be eligible for financial support, and he acknowledged how difficult any new measures might be.
We know from experience that local action can work when local communities come together to follow the rules, tackle the virus and keep themselves safe. And I know how hard this is. We're constantly looking for how we can ensure measures bear down on the virus as much as possible while protecting both lives and livelihoods.
Getting that balance right is crucial. For those on the front line now seeing more patients in intensive care, everyone must do their bit.
What is really frustrating is the whole of the healthcare profession has worked so hard, and we know that if we maintain our physical distance and wash our hands and wear masks, that we can limit the spread. And when we see people who are not listening to the advice, then we know that's going to lead to an increased number of cases.
Amidst all of this, the government's chief scientist did raise hope some vaccine may be available before the end of the year. But until then, the Prime Minister has only one form of ammunition to curb the spread, and that is new restrictions. Emily Morgan, ITV News.